We're going to start off with lesson one, which is before giving care and checking an injured or ill person. In an emergency, there are 4 actions you can take to make a difference in the outcome for an injured or ill person. First, you must recognize that an emergency exists. From there, you can decide to take action. If you do decide to take action, you're going to want to activate the Emergency Medical Services or EMS system. Basically, this means calling 911. And then give care consistent with your knowledge and training until EMS personnel arrive and take over. We have a good video here that we're going to get started with.
Can you believe they're catching the game last night?
It was amazing. You know, I thought it was over. I was ready to turn the TV off and go to bed.
Yeah, but they got lucky. They had no business winning that game.
Look, a win is a win.
Yeah, right. Oh, check him out. That guy looks like he was out on the field.
Seriously, though, you think he's okay?
I would assume so since he's out and about, but how can you tell? Hello? I gotta get to the office.
Yeah, me too.
Yeah. Okay. I'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Please. Dad, are you okay? Help! Dad, someone help my dad, please.
Sir, are you okay? Sir, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have this at the store.
Okay.
Dad!
It's okay. He's calling 911. Did your father complain about anything before he collapsed, or?
He was complaining about not feeling well, but he always complains, and then he just collapsed out of nowhere.
Do you know if he's allergic to anything?
Allergies... Aspirin. He's allergic to aspirin.
Does he take any medication, or?
I don't think so.
So a few questions about that video we just watched. First, what alerted bystanders to the fact that an emergency was occurring? Go ahead and take a second. So some things that might have alerted them were the daughter yelling for help. It could be odd sounds. Another one was seeing the gentleman was laying down on the floor. That's usually not a good sign, especially when they ran up and asked if he was okay. He was unresponsive. Even before all of this, you could see that he was kind of hunched over. He just didn't look right, and they seemed to notice that as well. What other observations might signal an emergency? In the real world, or especially like in the care home, again, it can be maybe you see a resident on the floor. In the real world, it can be you see a car that's crashed, or you hear a loud noise, anything out of the ordinary. And then the last question, what were some of the bystander roles depicted in the video segment? You can see that right when they sprung to help, the guy told the daughter, hey, can you get a first aid kit and an AED? Told another person, hey, can you call 911, while he was tending to the gentleman on the ground. So he turned it into a team effort in order to provide care. At the scene of an emergency, deciding to take action is not always as simple as it sounds. Why might someone be hesitant to respond to an emergency? So some common responses usually are maybe you don't want to spread germs. In a lot of these situations, there can be blood and other germs. And especially in times like this, where you already don't want to get close to people, that can make you hesitant to help. Another reason is fear of getting sued. Will you be liable if something happens? It could be a tense situation. Maybe you don't feel confident in your skills, or you just don't feel like you're the best person to respond to the emergency. In these next few slides, we'll talk about reasons that will help, or reasons you should respond to an emergency, and how you can help alleviate some of these fears. So first off, lay responders are rarely sued for helping in an emergency. Good Samaritan laws are in place, and these help to protect people who voluntarily give care in an emergency situation. So if your fear was of being sued, just know that these laws will protect you. To be protected, you want to obtain consent before giving care. Give care according to your level of training, and do not stop giving care until EMS personnel take over. In a first aid situation, your decision to act could make the difference between life and death for the person who needs help. The rapid arrival of EMS personnel greatly increases a person's chances of surviving a life-threatening emergency. Activate the EMS system by calling 911 or the designated emergency number for any life-threatening condition. What are some examples of life-threatening conditions? If you'd like, you could pause and try to think of some, discuss some if you're watching this with anyone else. Life-threatening conditions include unresponsiveness, an altered level of consciousness, maybe like confusion, breathing problems, severe external bleeding, vomiting, passing blood, signs or symptoms of a life-threatening medical condition, severe burns, suspected or obvious injuries to the head, neck, or spine, suspected or obvious broken bone, suspected poisoning, seizures. These are all examples of life-threatening conditions that you can see both in the care home and in the everyday world. Our next topic is giving care until EMS takes over. So consent is implied if the person is unresponsive, confused, or mentally impaired, or if it's a minor with a life-threatening condition and the parent or guardian is not present. If a person is awake and alert and does not give consent, do not give care. Call EMS personnel if you believe the person has a life-threatening condition and needs care. So an example of asking for consent is, if maybe I see a person who's bleeding, I could be like, "Sir, are you okay? My name's JP and I'm trained in first aid. Is it okay if I help bandage you?" Or whatever it is. Next, we're going to move on to this video called Check, Call, Care.
Now that you have recognized an emergency and decided to take action, follow the emergency action steps. Check, call, care. Before rushing to help an injured or ill person, you need to check the scene, so stop and look around. By answering the following questions, you will gain the information you need to proceed. Is the scene safe to enter? Hazards such as fire, spilled chemicals, and traffic, to name a few, could endanger you or any bystanders. If the scene looks unsafe, stay clear and call 911 or the designated emergency number. What happened? Check for clues that might tell you the cause of the emergency. How many people are involved? In an emergency with more than one injured or ill person, you may need to prioritize care. What is going on with the person? Form an initial impression about the nature of the person's illness or injury. If you see severe, life-threatening bleeding, take action to control the bleeding using any available resources. Is anyone else available to help? Bystanders may be able to provide valuable information about the situation or the person, along with getting needed items, controlling crowds, and reassuring the injured or ill person. Once you've checked the scene, you need to check the person. If you are not sure whether a person is unresponsive, shout using the person's name if you know it. If there is no response, tap the person's shoulder and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. If there is no response and the person is not breathing or is only gasping, the person needs help right away. This brings us to the second emergency action step: call. Unresponsiveness, trouble breathing, and severe bleeding are all signs of a life-threatening emergency. If your initial check reveals these or any other life-threatening conditions, make sure that someone calls 911 or the designated emergency number right away. The final emergency action step is to give care according to the conditions that you find and your level of knowledge and training. Always remember, check, call, care, and you'll be ready to respond to any emergency.
So before rushing to help, size up the scene and form an initial impression. Use your senses to gather information that will help you determine, is the scene safe to enter? What happened? How many people are involved? What condition are they in? And is anyone else available to help? As part of your scene size up, form an initial impression about what is wrong with the person. Maybe you can identify any of their injuries or if they appear ill. Are they moving or are they motionless? And do they have any signs of life-threatening conditions? Based on your scene size up, from there you might determine that you need to call 911, begin obtaining equipment, and provide immediate care for severe life-threatening bleeding. So we're going to have an activity here. I want you to think of these questions. If you need, you can pause, take a second to analyze each of the slides. So here's the first one. Really analyze, think of, does the scene look safe? What would you do in this case? So as you definitely see, there's many hazards here. There's spilled chemicals. There's some type of poisonous gas potentially. Looks like there's pipes falling, people passed out. In this case, you wouldn't want to just run into there and try to start helping everyone. You would actually want to turn right around, get to a safe place. Maybe that's run outside of this building and then call for help. Again, you can pause this if you'd like. So it looks like this scene is a little safer. Yeah, he might need some care for his bleeding. I'd say for hazards, you want to make sure that you move that saw out of the way. And it looks like there's someone that's available to help. So maybe one of you tend to him while the other grabs a first aid kit or calls 911 or both. And here's another one, pause if you need to. As you can see with this one, sometimes it depends. This could be a guy just sleeping in the park. It can be who's passed out. It can be a person who had a heart attack and needs help. So sometimes it depends. The next topic is call first or care first. If you are alone and there's no one to send to call for help, you may need to decide whether to call first or care first. Call first situations are likely to be cardiac arrest, while care first situations include breathing emergencies and life-threatening bleeding. So an example of this for the care first situation, if someone were choking in the dining room and you were to call 911 but didn't care for the choking, they would probably pass away before the paramedics could get there and help. Another general rule of thumb, call first for any person about 12 or older who is unresponsive. If it's a child or infant who you saw suddenly collapse, or an unresponsive child or infant who is known to have heart problems. Care first for an unresponsive infant or child younger than 12 years who you did not see collapse, for a person who is choking, a person who is experiencing a severe allergic reaction, also known as anaphylaxis, and has an epinephrine autoinjector, and for a person who has life-threatening bleeding. Our next topic is lowering the risk for infection. Just like in current times, this becomes even more important. Using personal protective equipment or PPE can help lower your risk for getting or transmitting an infectious disease when giving care. As you know, we're all wearing masks right now. In addition, you should be using latex-free disposable gloves with each of your patients. You want to be sure to change your gloves and clean your hands between each patient. And when you have your gloves on, you want to avoid touching other surfaces so that you do not spread pathogens and germs. Our next topic is checking a responsive person. So we have this mnemonic here, sample, where each letter stands for something. So S stands for signs and symptoms. A stands for allergies. M stands for medications. P stands for pertinent medical history. L stands for last food or drink. And E stands for events leading up to the incident. And we have a good video coming up that explains how to use this. After interviewing the person using sample, you want to check the person from head to toe. Tell the person what you are going to do before you begin, and avoid asking the person to move if you think the person has a head, neck, or spinal injury. Avoid asking the person to move any body part where he or she is experiencing discomfort or pain. I know sometimes it's tempting to force them to move it, but if there really is a serious injury like a fracture or something, you actually don't want to move that body part. For the head to toe check, you want to move straight down the body and then check the arms. So you start at the head and neck to the shoulders, chest and abdomen, down to the hips, each leg and foot, and then back up to the arms and hands, checking one body part at a time. What do you think you should look for as you check each part of the body? You could pause if you need. But some things you should look out for are bruises, discoloration, maybe temperature, like the skin being too hot or too cold can tell you that maybe there's circulation issues. Maybe you're looking for the areas of pain where the patient moves their arm away or their leg away or whatever it is. And here's a video of putting all of that together.
If your initial check of a person reveals that she is responsive and awake, get consent to provide care. If she does not have any life-threatening conditions, gather additional information by asking questions and performing a head-to-toe check. Begin by interviewing the person, or if necessary, any bystanders. Use the mnemonic sample as a tool to remember the interview questions.
So what's going on? Are you in pain?
My arm really hurts. I tripped and fell.
Okay. How are you feeling otherwise? Do you have pain anywhere else? Any shortness of breath, chest pain, or dizziness?
No.
Okay. Let me ask you a few more questions,
Okay.
and then we'll take a look at that arm. Is that okay?
Mm-hmm.
Are you allergic to anything?
Penicillin?
Okay. And what happens when you take penicillin? Have you ever had a severe reaction to it?
No, just a mild rash.
Okay. Are you taking any medications currently?
I'm on blood pressure medication
And when did you take it last?
this morning.
So do you have any other medical conditions?
No.
And when was the last time you had anything to eat or drink?
This morning, a bowl of cereal for breakfast. It was a couple hours ago.
So tell me what happened right before you hurt your arm.
I was going to lunch, and I tripped over a crack in the sidewalk. I'm just so clumsy.
I've been the same myself. Don't worry about it. And did you hit your head when you fell?
No.
Okay, that's good.
Once you've asked the person these questions, look at and gently feel each part of the body from head to toe, checking for signs of injury or illness.
Okay, I'm going to check you now for any other injuries. Do you mind if I touch you?
I don't mind.
Okay, I'm going to start with your head first. I'm going to take a look first. Okay. Does this hurt?
No.
And this? Mm-mm. Okay. Now take a deep breath for me. And breathe out. Does it hurt to take a breath?
No, it doesn't.
Okay. And are you having any stomach pain?
No.
And are you having any hip pain at all?
None.
Okay, that's good. I'm going to take a look at your leg now, okay?
Okay.
Does this hurt?
No.
And this? Ooh, it looks like you have a bruise there. We'll take care of that too, okay?
Okay.
And can you wiggle your toes for me? Are you in pain?
No.
Okay, good. Does that hurt?
No.
How about this?
Doesn't hurt.
And can you wiggle your toes for me over here? Any pain?
No pain.
Good. I'm gonna feel your arm now, okay?
Okay.
Does this hurt?
No.
And this?
No.
Can you wiggle your fingers for me? Good. Okay, I'm gonna feel your injured arm now, but I won't touch the bruised area, okay?
Okay.
Does this hurt?
No, it doesn't.
And this?
Nope.
And can you wiggle your fingers for me? Good. Are you having any back pain?
None.
Good. Let's take care of those bruises now, okay?
Okay.
Once you've completed a physical check of the body, provide care for any conditions you find. If necessary, send someone to call 911.
So again, sample and then the head to toe check. Next, we're going to move on to checking an injured or ill person who appears to be unresponsive. What should you do if you think that a person is unresponsive? Go ahead and pause this and think about it if you'd like, or you can pause it and discuss it with your partner. If a person appears to be unresponsive, shout using their name if you know it. If there is no response, tap the person's shoulder and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds, because again, if they're not breathing for that long, they need immediate help. And remember, gasping is not normal breathing. If the person responds by moving or moaning or opening their eyes, but is not fully awake, send someone to call 911. Proceed with gathering information from bystanders using sample, conduct a head to toe check, and then you could roll the person onto his or her side into a recovery position if the person does not appear to have any injuries. Here's the recovery position. So you're going to go ahead and bend their knees, put the arm closest to you over their head, and bring the other arm across and then roll them towards you. As you can see, this makes a solid base so they won't fall over. And there's a little clearance there in case they are vomiting so that they don't choke on it. If the person does not respond, send someone to call 911. Ensure the person is face up on a firm, flat surface and begin CPR immediately. And we will be talking about CPR in the next lesson.